Hi everyone! In this video, we are going to talk about contraceptive methods and we think you might be interested in. There are multiple methods to avoid unwanted pregnancies and to regulate hormones. For example, we have preservatives, patch, vaginal ring injection, diaphragm, intrauterine devices, spermicide, vasectomy, tubal ligation, and birth control pills. Birth control pills usually avoid ovulation. That means they stop the union between the egg and the sperm. If you take birth control pills carefully, you can avoid pregnancy. The majority of pills contain two types of hormones, progestogens and estrogens. This can be different between brands, so you need to pay attention to which ones you are taking. Do not change them in the future. This medication is used a lot in dermatology to regulate hormones, control acne, facial and body hair, and control oil production. It's important for you to know that pills prevent pregnancies, but they don't protect you against sexual transmitted disease. Because of this, it's better for you to use a condom during the sexual intercourse. There are many benefits when you take oral contraceptives. For example, they help reducing menstrual cramps, they reduce the menstrual bleeding amount. That means in some cases they help to decrease anemia in patients that have long and heavy periods, and also they regulate hormones when you have acne. There are two presentations of pills. We have 21 pills and also we have 28 pills. But how should 21 pills or 28 pills be taken? Let's begin with the 21 pills. Start the first pill pack with the first day of your period. You need to make sure that it's the pill that has the number 1 or the day that your period starts. Take 1 pill a day followed by 21 days. It's important to take the pills at the same hour every day. After you finish the 21 pill pack, you need to rest 7 days without taking pills. During that time, you will get your period. On the 8th day after the rest, start the next pill pack. Here are some examples of 21 pills. Now let's see the 28 pills. Start the first pill pack with the first day of your period. You need to make sure it's the pill that has the number 1 or the day that your period starts. Take 1 pill a day followed by 28 days. It's important to take the pills at the same hour every day. The last few days, taking the last pills, which usually have different color, you will get your period. When you finish the first pill pack, you must not rest or stop any day taking the pills. Start the next pill pack even if your period didn't come or if you still have it. When you start taking pills, the first pill pack will cover 2 menstrual periods, the first and the 4th week, and with the following packs you will present 1 menstrual period during the 4th week. Here are some examples of 28 pills. If you are not careful taking the pills or it's the first time doing it, it's easier to start with a 28 pill pack because you don't need to rest. If you forget taking the pill one day, take it as soon as you remember, hopefully within 12 hours. If you forget taking the pill more than 12 hours, take it immediately or together with the next pill of the day. If you have diarrhea or sickness, you can lose the contraceptive effect, so you must protect yourself with a condom during that month. If you suspect a pregnancy, you must take a pregnancy test, just to be sure, because you can take contraceptives in case the result is positive. Birth control pill doesn't interfere if you want to drink alcohol, doesn't make you feel sleepy, and doesn't disturb your concentration. Now let's talk about who cannot take birth control pills or need special pills. If you suspect you are pregnant, if you are breastfeeding, you need to ask your gynecologist because you need to take special pills to not affect your baby. If you smoke a lot, or if you have more than 35 years, you need to be careful because they can increase the side effects. If you have overweight or obesity. If you have cirrhosis or liver cancer. If you have thrombosis in your legs or circulation problems. If you have cerebral or lung thrombosis history. If you have autoimmune diseases, for example lupus, some patients that suffer migraine, and in cases like hypertensive patients, cardiac problems, triglyceride or vascular problems, it's better to inform your doctor. Here are some side effects if you take the birth control pill. Intermenstrual bleeding. In some cases, it can be because you are not taking the pill at the same hour, but if you present a lot of bleeding, it's better to ask your doctor. Amenorrhea. That means you don't have periods. It can be avoided by lowering the dose of the pills, but you need to know if you are pregnant or not. Fluid retention or weight gain. If you gain a lot of weight, it's important that you review your lifestyle, like exercise, diet, or search another causes. Breast tenderness. Venous thrombosis on legs or lungs. If you have long trips or you are taking pills, avoid sitting or staying in one position for long time periods. Headache or migraine. If you feel alterations in your body function or speech, ask your doctor. Vomiting and sickness. It can be reduced if you take pills at night or before you go to sleep. Nevertheless, don't stop taking the pills. If you do it, you can get pregnant. Melasma. Birth control pills can cause dark spots on your skin, especially on the face. If you have experienced changes in your skin color during your pregnancy or while were you taking the pills, you need to avoid sunlight or artificial light. Protect yourself from the sun, use sunscreen every day. Keep in mind these precautions. If you are going to have surgery, it's important that you let know the doctor that you are taking pills. The doctor will tell you if you can continue taking the pills or if it's better to stop sometime. If you have been taking pills for 5 years in a row or more, it's better to take some rest. It's really important that you have your vaginal cytology to make sure there are no changes in your cervix. If you are taking other medication, ask your doctor, especially if it's seizure medication. Keep the medication in the original pack tightly closed and keep out of reach of children. Store the medication in a cool, dry place, never in the bathroom. You need to throw away the pills that you didn't take. You can take them later. Don't share pills with friends or family. Remember that all women are different, and each one of them may need different medication. Finally, after you finish taking the pills, you can get pregnant. This method doesn't affect fertility indefinitely. It may take a few months until you get pregnant after stopping the pills, especially if you've never had a baby or if you have irregular periods. But there are women that get pregnant a few days after stopping the pills. If you don't want to take more birth control pills, but you don't want to get pregnant, you should start another type of birth control as soon as you stop taking them. So that's all for today. We invite you to follow us on our social media such as Instagram, Facebook, and to subscribe to our channel. Thank you so much. Bye!